Welcome back. We are following several new developments on the coronavirus front, including the potential for a vaccine for young children and concerns about an uptick that may be coming. We are joined now by our Dr. Jeff Pothof. We missed you last week from UW Health. Thanks for being with us, Doctor. I want to start by asking about the Moderna vaccine for the children 5 and younger. Do you think that we're even closer to getting that approved for that age group?
I do think we are nailing down a timeline. That preliminary data from Moderna looks pretty good in the sense that it does really protect against severe disease. With Omicron out there, we'll still have, kids who have mild symptoms, but they likely won't get very sick from it. I think the FDA will take a look at that data in the next week or two. It'll then go to the Advisory Committee on Immunization Practice. And I do think by middle to end of April, we could see those youngest children be getting vaccinated.
Okay, got it. Interesting. We're also hearing about a second booster shot for the children or a fourth dose of the vaccine for adults. Do you think that that might be coming up in the summer, ramping up for the next school year, that everyone will get it?
Yeah, I think the easy answer is eventually we'll all need a booster. The devil's in the details on timing. Right now, we know that immunocompromised people, they don't make as good of an immune response to those booster doses or the vaccine in general. So they're eligible for a fourth dose right now. What we're hearing is those who are 50 and older will also be eligible for a second booster. And that's because we know as part of the aging process, our immune systems don't react quite as aggressively to these vaccines. So that makes some sense. And there's some data from Israel that supports that decision. Eventually, those of us who are younger, healthier, will need a booster too. My best guess is that would likely happen sometime this fall, maybe before the traditional respiratory season.
Interesting. Also thinking about more variants with getting another booster. How about the BA.2 variant everybody's talking about? Do you think we'll see a surge in cases like we saw at the beginning of this year?
I have no crystal ball, but I think when we look at the BA.2 variant and what it's doing in other parts of the country, there's a lot of variables that are just different here in the United States as far as timing of our Omicron surge, how locked down we were during Omicron, how many people are vaccinated versus how many have recently been infected. I do think BA.2 could cause a slight rise in cases. I think it's less likely to cause a big surge and even less likely to cause an increase in hospitalizations. So we need to see how it plays out. If you're not vaccinated, not boosted, get that done. But I don't think that we can say that BA.2 is going to cause a lot of problems just yet.
Well, that's a relief. Dr. Jeff Pothof, thank you so much for being with us at noon. We always appreciate you. And a reminder, you can always find the latest information on coronavirus, including the latest guidelines and information about who is eligible for these booster shots at tmj4.com/coronavirus.